Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about standard precautions. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notifications. Let's get into the session. What is standard precautions? Standard precautions are the fundamental measures necessary to reduce the risk of transmitting infectious agents from both known and unknown sources of infection. These precautions are applied to all patients regardless of their diagnosis or presumed infection status to ensure a safe environment for both healthcare providers and patients. Now comes key components of standard precautions. First is hand hygiene. Hand washing, using soap and water to wash hands for 40 to 60 seconds before any task or when hands are visibly dirty. Hand rubbing. Use an alcohol-based hand rub for 20 to 60 seconds when hands are not visibly dirty. The main thing is follow the steps of hand washing. When do we wash our hands? Follow the 5 moments of hand hygiene, which we can easily remember by using 2B and 3A, where 2B is before touching a patient, before clean or aseptic procedure. 3A is after body fluid exposure risk, after touching a patient, and after touching patient surroundings. The next key component is use of personal protective equipments, that is PPE. First comes gloves. Wear gloves when touching blood, body fluids, secretions, excretions, mucous membranes, non-intact skin, and contaminated items. Next personal protective equipment is gowns. Wearing gowns is important to protect skin and clothing during procedures that may cause splashes or sprays of blood or body fluids. Next PPE are masks, eye protection, and face shields, which are used to protect eyes, nose, and mouth during procedures likely to cause splashes or sprays of blood or body fluids. The next key components of standard precautions is respiratory hygiene or cough etiquette. Cover your mouth and nose with a tissue or elbow when coughing or sneezing. Use masks for patients with respiratory symptoms. Next is proper tissue use and disposal. And the next important thing is performing hand hygiene after contact with respiratory secretions. The next key component of standard precautions is environmental cleaning and disinfection. Use adequate procedures for the routine cleaning and disinfection of environmental and other frequently touched surfaces such as doorknobs, light switches, bed rails, medical equipment, etc. The next key component of standard precautions is patient placement. Place patients who pose a risk of transmission to others, for example, those with infection spread by airborne or droplet transmission, in a single room when possible. Follow isolation precautions as required for specific infectious conditions. The next key component of standard precautions is safe disposal of waste, including sharps. Dispose of waste materials in accordance with local regulations for biohazardous waste. Avoid recapping needles. Dispose the used sharps in puncture-resistant containers. The next key components of standard precautions is handling of laundry. Used soiled or fouled linen. The used linen, irrespective of state, which on occasion may be contaminated by blood or body fluids, An infectious linen or dose that has been used by a patient who is known or suspected to be infectious. Handle, transport, and process linen soiled with blood or other body fluids in a way that prevents exposure and contamination of clothing and avoids the transfer of pathogens to other patients and their environment. Follow the hospital protocols for the proper disposal of contaminated items. The next key components of standard precautions is patient care equipment. Single patient use equipments are those which can be reused on the same patient but may require decontamination in between use, such as nebulizer masks, etc. Clean and disinfect reusable equipment before use on another patient. Follow manufacturer recommendations for disinfection of equipments. The next key component of standard precautions is safe injection practices. Use aseptic technique as and when required. Avoid reuse of needles, syringes, and single-use vials. By diligently applying these measures, nurses help to create a safe environment for patients, healthcare workers, and visitors, ultimately reducing the risk of healthcare-associated infections. So here you go with standard precautions and the key components of standard precautions. If you find this video useful, please like it, share it, and subscribe it. And do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.